This is RTP180.
So I'm going to start with some sobering statistics. These are national data from various sources, and you might see some variation in the numbers because these numbers are changing regularly, and many of them are going in the upward direction. You see that statistics in terms of the number of people who are taking opioids, who have had their lives lost as a result of it, and also the economic impact, which are sizable. One of the things that I think it's important for us to keep in mind is what's going on right here at home. We lost 12,000 individuals to opioid overdose between the years of 1999 and 2016. And this is having a devastating impact on families and on communities, and it's overwhelming the healthcare system that frankly is largely unprepared to be able to deal with the volume of patients that it's seeing. And a lot of doctors haven't been trained in the area of opioids, so that is a challenge for them as well. And patients don't have the information that they need. So why don't we go ahead and go to the next slide. And I'll just mention that opioids know no boundaries, where people are of all different ages, races, genders, economic status are being affected by this epidemic. Rural areas are hit particularly hard, and we know we have those in our state. The good news is that the awareness about opioids has increased. Lots of work in this area over the last year or two, recognition that we have a problem, and funding is starting to come. So that's really good, and I'm hoping that the research will follow. So a really important question is, do they work? And the answer is a complicated one. One answer is that when they're used as prescribed, opioids can reduce pain in some people. In some cases, they might lose their effectiveness over time, or they may not work at all. And that, in some cases, will result in people increasing their dosage or switching and trying something that might work for them. One of the things that's really important as we tackle this epidemic is that we keep in mind the need to balance that some people are genuinely benefiting from opioids, and we don't want to reduce or create barriers to their access to care. Balancing that with what we know that there is a possibility that people may misuse them, abuse them, or become addicted. So that is the challenge that we face. When you look at the literature and the evidence, there was a seminal study that was conducted a few years ago that many people reference. It's really well done study. It's a review of all other studies that are done, and it's done very rigorously. And that study concluded that the evidence is insufficient supporting the use of opioids for chronic pain over the long term. And the reason for that is because many of the studies were done and only looked at up to 6 months. And the studies had limitations. So more work is being done and evidence is coming out all the time, so we need to continue to monitor that. Another key consideration that people need to keep in mind is that there are side effects. You may not get all these side effects. You're most likely to probably get the first one. But this is the kind of information that patients need to be talking to their doctors about, thinking about alternatives to opioids as well, knowing that exercise is an option and there are others. So this is what I'd like to see the conversations going on with patients and providers. Okay? All right, so that brings us to a study that we're very excited that we're just starting up. It's a 5-year study, $9 million. RTI is collaborating with Duke, Vanderbilt, and the University of North Carolina at Chapel Hill. It's an awesome team. We're a very collaborative group, and I'm really looking forward to working with folks on this over time. Okay, so this is a little bit more about the study. We are comparing 2 different options. The first one is called shared decision making, and essentially that focuses on educating both patients and providers, providing them information that they need. Focuses also on the decisions that really weigh the preferences and values of patients and making sure that's included, and uses different kinds of decision aids and supports and tools. The second approach is what's called cognitive behavioral therapy. This is delivered in groups, which has some advantage where people are able to support each other. And we're looking at which one of these is going to be more effective. They both have evidence behind them, of course. And we're going to be including 1,000 patients. Each will go into one of the groups, and we're going to be supported by a patient advisory council, and one individual, Ms. Linda Cox, will be the patient representative and partner with us on that study. We're also supported by these groups. Okay, and I'm going to wrap it up because I hear the dinging going on. I will put in a final plug for what's going on at the state level, a 7-point plan to address opioids that attacks it from both, from all different sides, including increasing treatment, supply, and demand issues. And then finally, you can see that there's also a lot of focus, which I really applaud the effort, on collecting data because we need to be able to make informed decisions and track what's happening over time.